Solutions Barbados welcomes the candidate for St. Michael South. Please welcome Paul Gibson.
Good night, fellow Barbadians. My name is Paul Gibson, representative for St. Michael's South. Whoa, what an amazing group of people tonight. What a powerful presentation of believers, of Barbadians that understand the season that we are currently in. We have already pulled the curtain on the current state of affairs in the nations, of this precious nation. Barbadians, we are seeing and hearing daily through the voices of our economic luminaries the same message that Solutions Barbados was shouting, no, screaming from the mountaintops, while the members of the opposition sat with their hands open, just waiting to receive a government. But our colleague Scott tonight says, no way, you have to have a plan or you have no vote. Tonight, we are not only here to present 25 candidates to you in this historic location, we are here to tell you that our policies are now being embraced and touted by our own opponents. They need to find their own. If you go to the Solutions Barbados website, look at over 2 years of policies that we have had there, and they cannot even find their own policies. They're talking about drones for agriculture. They're talking about transportation and reinstating University of West Indies. They're talking about corruption legislation. They're copying our solutions. And I want to make it public here tonight that that is what they're doing. They have no innovation, and it is very, very sad. I must tell you this tonight. Our policies will put us on track for the next 30 to 40 years. And this is what we are about tonight. Now, regarding health, because this is something that is very close to my heart. We currently have, for example, patients trying to fit into what I call, or what I describe as the pressure cooker system of the healthcare system of Barbados, of this fair land. This is a daily pressuring of the human resources, the plant, the financials of the polyclinic and the hospital. Now tell me, has anyone taken a family member or yourselves or someone or friend to the hospital recently? Has anyone experienced the long delays that are seen in that institution? Is anyone realize that sometimes it takes days to be seen in that institution? I'm telling you, I had a situation at the end of July where I had what's called a PE. And I got through well, I was taken care of pretty well. But I was able to sit and observe asthmatics that were sitting in the accident and emergency department for 4 hours. They were nebulized, but they were just waiting for a doctor to listen and auscultate their chest to write a prescription and tell them to go home. 4 hours. And I saw at least 8 people, friends, walk out of that place with a baby under their armpit and went home because they just could not get a doctor to listen to their chest. And these are the things that concern us as a party. Unfortunately, there's an expectation that family members should know, clean, wipe down, and bathe, and feed the sick, as opposed to the personnel who are so hired to do in the institution. Now, don't get me wrong, there's nothing wrong with helping out your sick one in the hospital. I don't have a problem with that. But nursing is a profession. It's a very serious profession. And nurses are trained to take care of certain things. And sometimes if we are asked to do certain procedures to our family members while in the A&E department, many times we can cause injury to our families. And we don't even realize that we can actually cause injury to some of these persons. The health system in Barbados does not need a plaster, ladies and gentlemen. What it needs is reconstructive surgery. Doctors are stressed. Nurses are stretched. Orderlies are stretched. The personnel in the finance department are trying to find funds to pay for drugs and medical supplies and salaries. The pharmaceutical department, somebody said, trying to find money to buy toilet paper. The pharmaceutical department is stretched. The oncological department is stretched. The polyclinics are bursting. Has anybody been to a polyclinic recently? They are bursting. The physiotherapy department is also stretched. Ladies and gentlemen, reconstructive surgery is what is required. What does a healthcare system of the future look like? It cannot be fixed by looking through the same lenses of 20 years or 15 years ago. It cannot be. Ladies and gentlemen, we have an aging population, and we need to care for double the number of elderly people with diseases such as strokes and heart attacks in this country, Barbados. We have 250,000 people in this country. We have 2 strokes per day and 1 heart attack per day. Think about that. How many strokes? 2 per day and 1 heart attack. Among the group of the aging, Alzheimer's will be more real to many of us than we could even imagine. We are planning for an avalanche. Are we, planning for this avalanche? Do we have enough nursing homes in this country? Because we will need many, because we have an aging population. Do we have adequate rehabilitation services for these stroke victims and the heart attack victims that are having all these strokes? Are we putting plans and things in place for food security and the production of healthy food for this country? It is something to think about. My fellow Barbadians, these things have to be planned for. And unfortunately, we have not seen a demonstration of planning. If we have 30 to 40 years coming, and we have an aging population and a sick population, somebody must give it thought. Somebody must plan for what is going to happen. All things are created twice. First as a thought, and then it is expressed or made or developed to become a reality. The Democratic Labour Party and the Barbados Labour Party tried their best for the future of this country. I believe so. The sad thing, they have not done what it takes to make this country what it needs to be. I am happy to tell you tonight, ladies and gentlemen, that his Solutions Barbados Party, with the hand of God, like Martin Luther King, we have fixed our eyes on the promised land. Martin Luther King he dreamt of what freedom and fairness, and worked for the dream until it was outwardly expressed. He gave his life for it. And if you love your country, I'm sorry to say, but sometimes you have to give your life for your country if you love it. And this is what these people up here are doing. Politics is not for the faint of heart. If you love your country, we give up time, family, personal time, and so on, to come and say to Barbados, we are ready to serve you because you're not being served in the way that you rightfully deserve as a Barbadian. Mahatma Gandhi and Malcolm X had dreams. They were terrorized and beaten, but they pressed. And by the way, no one said it would be easy. These men were in the same exact position that we as a party find ourselves in tonight. With a vision, we stand today. Some people said that it can't work. Some people told these men of old that they will not see the outworking of their vision. As a party, we feel and hear these comments daily, like Mahatma Gandhi and possibly President Barack Obama. But we press, ladies and gentlemen, with fire in our bellies, the goal of restoration of the health of this nation and the protection of our children's future. We press, we rise to the challenge, we seek God's guidance, and we campaign and share our vision. We share our vision with you here tonight. Solutions Barbados has a dream for Barbados, ladies and gentlemen. We dream one day that the financial resources of this country would be restored above acceptable levels, where the healthcare landscape is planned and structured in such a way that we will be seen as center of excellence across the world in cardiac care, in rehabilitative care, in emergency care, in ophthalmic care for your eyes and your glasses, for pharmaceutical care, excellence for all major health surgeries in Barbados, a center of excellence for diabetes and hypertension, a center of excellence for transplant surgery. Our vision is one in which Barbados will have the highest rate of ease of doing business of any country in the region. This is our vision. A Barbados that has a banking sector that gives a fair shake to young, budding entrepreneurs, young business people, young people, and gives you, as a Barbadian, respect, because they're not respecting us, giving us these interest rates. What are 0.64%? What is that? And charging you $3 or $2.50 to do a deposit. You know, this is the Barbados we're living in. Banks need to show Barbadians respect. So we will have our own bank, and we will make sure that people that are entrepreneurs and want to do business in this country have access to funds and to fulfill and fund their dream. A Barbados where we are our brother's keeper, and civility is the norm, where we respect each other as human beings. This honoring of one another will not be based on wealth or color or social class or educational status, but as individuals to take care of each other. We will no longer see children fighting and just drive by or just pull out our cell phones and record it, but we will seek as individuals to make sure that that confrontation cease. An environment where women, young and old, are not spoken as of objects of lust, but are respected, treated equally in Barbados, in the boardrooms, in the corporate rooms, in the legal firms, the classroom, and in sports. A Barbados where customs officers, personnel working at the licensing authority where they deal with licensing matters, Barbados Revenue Authority, pharmacists in public facilities, and doctors respect and treasure and value your time as Barbadians. You see how long you have to stand up in some of these lines in this country? We want to seek to improve the quality of service we offer to each Barbadian. We understand that we all have to get back to work at a reasonable time, and therefore offer timely, efficient, high-quality service to each other. This is where the ISO 9001 plan identifies what the ideal job looks like, the ideal service looks like, and seeks to remove the barriers that would stop us from achieving the ultimate excellence in service, and demonstrate measurable improvements in productivity, and seek to ensure continuous improvement in our systems and processes. This allows us to operate as a well-oiled machine and as a country. But we have understood as a party the challenges. We understood what it takes to change this nation. And tonight, my friends, family, brothers, sisters, as I close, under a Solutions Barbados Party, we will have a well-managed, people-centric, child-protecting, corruption-eliminating, ease of doing business, God-fearing, God-honoring, health-conscious, law-abiding, flourishing nation. My closing charge to you, my friends, vote Solutions Barbados in the next general election. I bless you. May God bless you. And may we keep our eyes on the prize. God bless you.
Thank you, Paul Gibson.